This is my presentation for the cigarette smoking screencast and primarily for how to become a smoke-free campus in the workplace. So the major health risks of cigarette smoking include cancer, and cancer changes the daily functions of the body and weakens the immune system. Another health risk is a heart attack. This deprives the heart muscle of oxygen, which kills the muscle and allows for scar tissue to form. Another risk is stroke. This gives muscle weakness, possible paralysis, problems with balance and movement. And a final health risk is heart disease, and it causes fatigue, weakness, shortness of breath, and chest pain to the body. Health benefits of smoking cessation. A couple of examples. When people stop smoking, the risk of developing heart disease and some kinds of cancer eventually decreases to that of non-smokers. Within the first year, a person's risk of early heart disease falls by 50%, and within the first 24 hours, a person's chance for heart attack decreases. Their body's carbon monoxide level starts to decrease, and their blood pressure improves. Some effects of smoking are reversible, and in just 48 hours, the person's sense of smell and taste improve. This is all great news for the person who's trying to achieve non-smoking, as they'll be able to see some instant results and move forward. The impact of a smoke-free environment on wellness. A few examples is in New Zealand, they adhere to a Smoke-Free Environments Act. The act stopped print media advertising, restricted shop advertising, phased out sports and event tobacco sponsorship, and created a health sponsorship council to provide smoke-free sponsorship. It prohibited smoking in buses, domestic aircraft, lifts, multi-person offices, and the public section of any workplace. In Wrightington, Wigan and Lee NHS Foundation Trust Hospital in the United Kingdom, they went completely smoke-free in 2010. Even after receiving criticism, the hospital persevered with its initiative and doubled its efforts to educate its staff and patients regarding smoking cessation. The criticism that they received was when they removed their smoke shacks, and specifically the employees and those visiting patients wanted them put back on, but the hospital persevered and decided not to rebuild them. And when implementing a smoke-free workplace, it is important to also build an education and cessation program. Employees in a smoke-free environment. Some things that will change when we introduce a smoke-free environment. It will enhance morale. It shows concern for the employee's health. The employer provides cessation support primarily through health insurance. It creates a healthy workplace. It will also reduce medical leave occurrences. It will improve the health of employees who were smokers or those who used to have exposure to other smoke. It increases attendance and productivity. It raises the number of staff who choose to quit smoking. By this example being set, they will follow some people who possibly weren't thinking about it before. Improve corporate image. More candidates will apply to a business which supports its employees' healthy habits. The business aligns itself with positive resources in the community. The businesses which have not converted to a smoke-free environment will gain scrutiny and a possible poor review. People want to know why they're not following this new healthy trend. So how can we use behavior change theories to evaluate a person's readiness to quit smoking? Through pre-knowledgeable, people will they'll know a few factors that contributed to their poor health choice. Knowledgeable, learning the details of their addiction. Approving, they're agreeing to create change. Intending, searching for helpful resources, confiding in close friends and family of their intentions. Practicing is when they're using techniques and resources to gain positive outcomes. And advocating, becoming a voice for change and retelling their success story of quit smoking. And why it's important to model positive lifestyle habits. Others will catch on and possibly follow your example. You can connect people with resources they may not have discovered. You show people how to treat you and your level of health concern. If you're a parent, you'll be showing your children how to live a healthy lifestyle. You show others you choose to be happy, and happiness is contagious, which is good news for everyone. So some smoking cessation aids. Nicorette is a very popular one and easily accessible. When used as directly, Nicorette gums and lozenges effectively relieve your cravings and help you reach your goal to quit smoking. Nicorette helps provide effective relief for cravings associated with quitting smoking by delivering a controlled amount of nicotine to your system. So Nicorette contains nicotine, And on the other side, we see Chantix, which does not contain nicotine. And Chantix attaches to nicotine receptors so that nicotine can't. With Chantix, dopamine is still released, but less so than with nicotine. It is believed that these actions are how Chantix may help you quit smoking. Chantix does tote itself as a non-nicotine gum, but Chantix is not as easily accessible. It is prescription-based. So these are my references for this presentation, and this is the end of the presentation. So thank you for your time.